September is Prostate Cancer Awareness Month, and an interesting 10-year study on prostate cancer survival rates was just released. In it, some promising, interesting results. Dr. Ryan Dorn is here from Hartford Healthcare. Good morning, and thanks so much for coming in.
Thank you for having me.
Okay, so help us break this down. We were just talking a little bit about what the results were. What can we share with our viewers on this?
Sure. So this study was designed to see what would happen if you compared men who decide to have surveillance for prostate cancer with men who decide to have surgery for prostate cancer with men who decide to have radiation for prostate cancer, because those are the three most common ways we manage this disease in modern times. And what they found, and this was a study done in the United Kingdom with 1,600 men, what they found was that at 10 years, the men who started out with surveillance versus surgery or radiation had the same rate of survival. Interesting.
Okay, so the takeaway then, to perhaps explore some of those other options, a monitoring approach as opposed to sort of more of an active treatment?
And that's something that's been coming to the fore more and more in the last couple of years, especially as we've learned that certain prostate cancers take a long time to grow. Important things to note about this study, though, are that the men who were put in the surveillance group, where they did not have any treatment up front, did eventually get treatment in many cases, and actually about half of them ended up getting treatment, or more than half, by the end of the trial. They just avoided having treatment for a few years and watched to see whether the cancer seemed to get worse or bigger.
Prostate cancer, when we talk about it, we often hear, oh, it's a slow grower, it's something that can be, you know, as we're talking about, monitored. But there's also cases where it can be very aggressive quickly, aren't there? Like, it's not just a one-size-fits-all kind of diagnosis.
Absolutely. And actually, most of the men in this particular trial had fairly low-risk cancers with low PSA levels and low Gleason grades, which is a measure of the aggressiveness at the beginning of the diagnosis. Also important to know is that this is at 10 years. So for me, one of the more important points to take from this trial is that if you have less than 10 years to live, likely, based on your age and other health problems, then you should very seriously consider surveillance as your first step for prostate cancer. However, if you have longer than 10 years to live, and for men in the United States, that's most men 70 years of age or younger, then treatment might be still the better option depending on your disease.
Important information, certainly a very important conversation as well. Dr. Dorn, thanks so much for coming in.
Sure,
we
my
appreciate
pleasure.
it.